This is part of the Stanford School of Medicine Research Basics video series, and the topic of this module is research ethics, or responsible conduct of biomedical research. And in discussing responsible conduct of biomedical research, I'm going to really kind of focus on the opposite, which is research misconduct. How do we avoid research misconduct and in turn focus then on conducting our research in a responsible manner? This little picture depicts a principal investigator wearing his nice suit and tie, talking to a student in the lab, saying you're completely free to carry out whatever research you want, so long as you come up with these conclusions. And the PI is holding an NIH grant. He's written this grant. It has a hypothesis and specific aims and methods, and he knows what experiments he wants done. He also knows what kind of data he wants, and he's telling the student, hey, this is what you need to find for me, because the next submission of that grant or moving forward with that grant really requires coming up with the type of data that he's expecting. Objectives then are to describe the expectations of the public for researchers and the public perception of science and scientists as kind of an introduction. And then I'm going to define research misconduct and the motives of those who commit misconduct. Talk about who gets hurt and why and the overall impact of that, and then talk a little bit about preventing or detecting research misconduct. So the responsible conduct of research is covered in kind of four major areas, and the first is subject protection, and I know you're going to talk more about that, but that applies to both humans and non-human subjects, meaning the animals. And we have an institutional review board, or an IRB, that oversees human studies, and an institutional animal care and use committee that oversees studies in animals. And when you're learning about the IRB, you'll learn about autonomy of individuals to make their choices due to informed consent to be involved in studies and withdraw. Beneficence, which means try to do no harm, and then justice, which is spreading the burden of that research across ethnicities, but also the benefits. In other words, you don't want to choose one ethnic group to do the study on that's going to cause them harm and leave out the rest, but you also don't want to exclude one ethnicity from those studies because they might benefit from them. In terms of the IACUC, the idea is that when we're using animals, we need to look at the 3 R's: refine, reduce, replace. So if you can avoid using animals and replace them with cell culture, for example, you would do that. You want to reduce the numbers of animals that are used in the study, just enough to achieve statistical significance, but not overusing the animals such that it's wasteful. And then animals in studies will sometimes face some pain and distress. And the idea is to refine the experiments to reduce that pain and distress, not eliminate, but try and reduce it as best possible. And there are regulatory agencies that will oversee that. In terms of research integrity, we have to have integrity when we collect our data and understand what it means to be stewards of the data and have ownership of the data in terms of storage, safe storage, and then sharing, obviously, that data with the public through publications or through presentations or through posters. There's a section on in this module, I believe, on authorship and peer review. We want good mentoring. Someday you're going to have to choose a mentor, or you're going to be a mentor. And that may be throughout a career where you have this established relationship. But good mentoring is very important to research integrity. And then in collaborative research, we need to know our duties and responsibilities, and that involves communication and trust from the very outset. Environmental health and safety issues. We don't want other people in the lab to be harmed. Or, for example, if we're using animals and we're using chemicals in those animals, we don't want people that are animal technicians to be harmed. And then again, regulatory agencies look over those radioactive materials that might be used or biohazards that are generated. One really interesting area of research is DURC, or dual use research of concern, which there's a lot of interest in that now, but it's research that based on our current understanding, can be reasonably anticipated to provide knowledge or technology that could be directly misapplied by others who have bad intentions and would pose a threat to the public health and safety, to, say, our agricultural crops, to animals, our food supply, the environment, other materials, or to our nation or to society. So it's like you have good intentions in doing the research, but then somebody takes what you've published and uses it against society. And then there's fiscal accountability, which is disclosing financial conflicts of interest. We need to be very clear about that. So when people even read a manuscript, they understand, or read a published paper, they understand that, oh, that was funded by a drug company and you're promoting the use of this drug in this study. Or if you're receiving money from a drug company and from a public funding agency like the National Institutes of Health, that those things shouldn't be in conflict with each other. Using those funds appropriately. And we have grants offices and accounting offices, and we have to submit budgets and budget reports, financial reports on how the money was spent. It should be spent the way that it was intended to be spent. Taking a little bit of a turn here then into the public perception of scientists and science, I think science definitely influences decisions that individuals make, because you see ads all the time. They like to put the words like scientifically tested, scientifically proven to achieve these results. And that carries a lot of weight with the public. The public perception of science, at least pre-pandemic, I would say, was that science was very systematic and exact and objective and unbiased. Now that may have turned a little bit, because we know that in some cases researchers came up against it with politicians. It was based on, economics as well, came into the equation. And there was maybe a little bit of distrust at times of some of the researchers who had decades of experience, right? Because the recommendations changed a little bit. And that's because the layperson doesn't really understand that sometimes scientific method in our research can generate erroneous results. So that's not misconduct. It just means that we haven't found the truth yet. We haven't found enough consistency within the data. There is an evolution of our understanding, and that means that we're getting new data all the time. It's being collected and evaluated, and that can change our perspective. And sometimes the public gets really confused by that idea that it should either be black or white, not gray. But for example, coffee. I knew a researcher, a colleague from another university, who studied the adverse effects of caffeine. And then he got this $4 million grant from the National Coffee Bean Growers Association to study beneficial effects of coffee. And so now all of a sudden it became beneficial effects. But caffeine is not the same as coffee, right? Caffeine is just one component of coffee. In terms of alcohol, we hear, oh, alcohol's bad for you, alcohol's good for you. The layperson has a hard time interpreting that. Well, we know, there are limits, right? A little bit of alcohol is good for you, too much is bad for you. But there's also questions about, like, is it just red wine because of the tannins in the wine, or are there other beneficial effects of alcohol that are maybe associated with an ounce of whiskey a day? Is oatmeal good for you? Well, maybe that's not so controversial, but there was a time where, that was really being promoted, and then people started moving away from it because they were being told, well, it depends on what time of day you take your oatmeal or eat your oatmeal, and obviously most people eat it in the morning. But it's the same thing with drugs like Metamucil that are used as laxatives, bulk forming laxatives that have psyllium or fiber or bran or anything like that in it. Let's say that you are taking that Metamucil and they promote that product as having cholesterol lowering effects, right? It binds up cholesterol in your diet as well. But if you take it at the same time that you're taking a statin to lower your cholesterol, then those two things might cancel each other out, because the statin might bind to the components in the Metamucil and just pass through your GI tract, and the statin is never absorbed. Therefore, that's a bad drug-drug interaction or a food-drug interaction. if you're talking about oatmeal. And that can be confusing. And with low dose aspirin, I have a picture of Bear there, low dose. We talk about low dose aspirin, 81 milligrams, as being heart healthy. So should everybody take it? Primary prevention, or should people who've had a heart attack, should they be the ones who take it for secondary prevention of a heart attack? And there are studies showing that, yeah, maybe a low dose is cardioprotective, but for older gentlemen in particular, it can put them at an increased risk of a hemorrhagic stroke. And then, of course, there's a whole vaccine debate, right? Vaccines linked to autism, which is based on fraudulent findings, misconduct. That's been proven. And the other thing that affects the public perception is maybe you and I and most of the people that work in research or have an understanding of medicine and the research areas understand that there's different types of science that come out. There are data that come out, the original manuscripts come out, it's replicated, reproduced in multiple labs. Pretty soon it makes it into review articles, and then that data from the review articles makes it into textbooks and multiple textbooks, and that has withstood the scrutiny of time, the textbook science, and is less subject to change. But then we have the cutting edge science that's just coming out, and it's really exciting, but it's volatile, and it's less reliable, and it's much more subject to change. And that's what we saw during the pandemic when it came to things like hydroxychloroquine and ivermectin, where information was being released to the press and then to the public in this cutting edge phase before the work had really been replicated by others. And so our recommendations from our agencies changed over time as new data was collected. And some of those studies involving ivermectin and hydroxychloroquine have been shown to be either really poorly designed studies or actually involved research misconduct. In terms of even individual researchers, there can be a misconception that all scientists, all are virtuous and upright, and that you're impervious to ambition and incapable of misbehaving. But reality check is that researchers are humans, and humans are fallible. They're impressionable, so people can influence them. They're impulsive at times, and also at times subjective, not as objective as we'd like to be. And so we may subconsciously engage in research misconduct, or going to the other extreme, maybe knowingly engage in research misconduct, but then rationalize it away as saying, well, I think this is the way data should be collected. And so we can engage in that self-deception. Defining research misconduct. So before I get to that, I want to talk about there are a few rare cases that go back to the 1800s, and I'm not going to besmirch anybody's name, but there were a few rare cases that have come up where at least people plagiarized and didn't give appropriate credit to some of the people involved in studies, right? So in the 1980s and 90s, it became clear that there was research misconduct being done at some universities. And so in 1993, Congress got involved and created a commission on research integrity to look into these allegations of research misconduct and think about how we can approach that, what can be done. And so Kenneth Ryan was the name of the chair of the Commission of Research Integrity, and sometimes the report that was issued by that commission is called the Ryan Report. But that came out in 1995 and called for a uniform definition of research misconduct, which we'll get to, but it also defined how we can have oversight, investigation, and adjudication in a consistent manner, and also a Bill of Rights for whistleblowers, because a lot of times if somebody did tell on others that, hey, there's research misconduct being done in this lab, they were just excluded from science. Their lives were kind of ruined. And so we had to find a way to protect those folks. And again, this definition that came out was uniform, because before that, some people would say, well, that's not really misconduct, or that's not really misconduct. So they came up with a uniform definition that's pretty consistently used within the United States now. And this is it. Research misconduct is defined as fabrication, falsification, or plagiarism in proposing or reviewing research, or in reporting research results. Now we'll go back through what fabrication, falsification, and plagiarism are. But a finding of research misconduct requires that there be a significant departure from accepted practices of the research community. And that created some waves because people were like, well, it's a good idea for researchers to think outside the box sometimes and not do everything exactly the same way as somebody else does it. But they're talking about in terms of the way that the data is collected and analyzed and reported. The other thing is that misconduct requires that it be committed intentionally or knowingly. So you can't accidentally commit misconduct. If it was an accident that you made in your reporting, that's not misconduct. That's not considered research misconduct. And the allegation has to be proven by a preponderance of the evidence when the investigation is underway. But there is a point in here about recklessly. So misconduct may be committed recklessly. So if you're collecting data and you're not keeping accurate records, and people can't go back and check on that because you're so reckless with the way that you're doing your experiments, that could be considered research misconduct, because maybe you're trying to underreport or underrecord your lab results, and there's no access to the data to really show what happened. So fabrication, falsification, or plagiarism. We try to avoid the term fraud until everything's been adjudicated, and that's kind of a legal definition. So just research misconduct is not the same thing as fraud. Fraud is when it's actually been determined that something was wrong, and maybe the government was defrauded of grant money. So the three most egregious transgressions in science, which are known as the FFP core, or the three cardinal sins of research, are fabrication, falsification, plagiarism. Fabrication is just what it sounds like, making up data or results and recording or reporting them as such. So you're just completely making it up. And this has happened where people in clinical trials, they don't have enough subjects, for example, so they just duplicate the data and give it a different identification number or name. Maybe make a slight change to it, but for the most part, it's just fabrication. They're just making up data. Falsification is manipulating data or research materials or equipment or the methodology, processes, or they're changing, like I said, manipulating the actual data. Maybe they're omitting data points so that the research record that is being reported is not accurately being represented anymore. And sometimes we call this cherry picking. So one of the common things that researchers may do in misconduct is omit data points. So let's say that you have 20 subjects in an experiment. You're looking at maybe an antihypertensive drug. 15 of those 20 subjects responded very well to the drugs, and 5 had absolutely no effect. The drug that you're looking at had no effect on blood pressure whatsoever. When you start to do statistical analysis of that data, it's going to be a problem because only 15 of the 20 responded. And so there's a temptation then to just say, well, there must have been something wrong with those 5 subjects. So I'm just going to omit the data from those 5 subjects. And now your data looks much clearer. And that's called cherry picking. And you get nice statistical analysis, nice results from that. But it's not an accurate representation of what really happened, right? And then plagiarism, I think we're all familiar with that. That's the appropriation of another person's ideas or processes, maybe the methodology, results, or words without giving appropriate credit, without citing the source. That has been shown to happen when people submit a grant, for example. They submit a grant to an organization, it's reviewed by peers that work in that field, and maybe the grant doesn't get funded. But the person, one of the people who was reviewing that grant, takes that person's ideas and the methodology that they're proposing, and they go back and they use that in their lab and reproduce the data from that other person's grant. And that's research misconduct. So those are the 3 cardinal sins of research. So what are some of the motives for research misconduct? Why would people do this? And I think you can come up with some ideas. One is career advancement. You know, you want to keep your job. In some places, you have to have tenure, at least for stability of your position. Or maybe you want to get a promotion from an assistant professor to an associate professor. So you need to create more data to get more money for your grants, for your lab, and more publications. Or the promotion leads to an increase in your salary and also a little bit higher prestige within the university, but also if you're working at a university where you're not happy and you want to move up to a top 10 research university, then that would create some upward mobility because you're now an associate professor and you've got grants and you've got great publications based on research misconduct, but it would lead to upward mobility. So people might be tempted to do or to commit research misconduct for those reasons. There's a tendency to want to be the first to publish research findings. So if you know you're in a competitive area, you want to get that publication out really fast, and maybe you're taking shortcuts by just plagiarizing sections of a paper, or you're fabricating or falsifying some of your data. Journals want to publish positive findings. So if the work that you're doing is turning out that it doesn't support the hypothesis you started with and you have negative findings, maybe they're not that interesting and it's harder to get those findings published. So you fudge it a little bit. You do some misconduct and now your paper looks better and it can get into a journal, and the even more relevant findings, the more highly statistically significant findings, and the more generalizable those findings are, maybe you get it published in a higher quality journal that has a higher viewership, and that would lead to more prestige and upward mobility and et cetera for the investigator. There's also a hierarchy of individuals in the lab that are putting pressure on each other because of time constraints. For example, a principal investigator, like in the image that I showed on slide 1, has a NIH grant. They need the data because maybe a deadline for a progress report is coming up, or they need to resubmit that grant to get more funding for the project. Might put pressure on a fellow or a student or a technician in the lab. A fellow is maybe coming to the end of their time in the laboratory and they need a new position. So they might be put pressure on a student or a technician to get the data that they want, positive data that supports the hypothesis that's going to get them a good publication in a good journal. A student might need a paper published. They might need a publication. For example, our graduate program requires that a PhD student publish a paper on their research in order to graduate. So if the data is not coming out very well and the project's not going very good, then they might put pressure on a technician or themselves to create data, fabrication, falsification, and plagiarism. Maybe they'll take data from somebody else's work and make it look like their own, or manipulate some images to make it look like their Western blot. Protein assays look the way that they're supposed to. Finally, there's one that's probably a little bit more strange, is an arrogance of a researcher, moral defects, for example. The notion that, well, I'm a researcher, I've been working in this field, I'm pretty well established, I have this set of experiments, but I already know what the outcome is going to be. I know what the data is going to look like. I know what the data will show. So why should I waste my time in the lab? I'm just going to go ahead and write what I believe happened, make a figure, and put that in the paper. I'm going to completely fabricate that, and that actually happens. Or I'm going to, again, cherry pick. I'm going to throw out the data points that I don't like to make my data look tighter, my statistical significance look better. And rather than write some of these sections, I'm just going to find papers that are in a similar field and take sections from them and plagiarize. The other thing is, some people think there's no way that what they're doing can be challenged because, I'm so good in my lab at what I do that even if another lab can't replicate my findings, that's just their problem. I mean, they're not very good at their technique. So I don't have to actually do the experiment. I can just make it up and people will believe me because I have the reputation of being really good at this. In terms of who is harmed, I bet you can imagine a lot of different scenarios of who's harmed when people are involved in research misconduct. It's very broad, but more than even might come to mind. I mean, you can think about in clinical trials, patients could be put at harm if there is misconduct. But even before that, in preclinical trials, let's say in the animal studies, where people were trying to figure out, does this work and what's the appropriate dose and is it safe? If there's misconduct at that point, then you're putting patients at harm in phase 1 clinical trials. Sometimes careers are destroyed. Prison is possible. I haven't heard of very many cases where a researcher went to prison, but if a patient died in a clinical trial because of research misconduct, it's possible. But certainly careers of the involved persons could be destroyed. And what typically happens, rather than prison time, is that there are restrictions put upon them that prevent them from engaging in any kind of research activities. They're not allowed to work in a lab. They're not allowed to submit grants or proposals or work on any funded projects. And it also leads to papers being retracted, which doesn't look good for journals or obviously for that individual. And what I mean by retracted is you might have papers published, and then once they find out that, hey, that data was fabricated, the editors just withdraw those papers and they're no longer available. They're listed as retracted. And there are cases where so much data was fabricated by a single investigator that up to 50 papers had to be retracted by an investigator. There's obviously a stigma that undermines the credibility of all of that person's work, past or future work even. So maybe they just cheated, fabricated one figure or falsified, one paper, but that really calls into question their past work and whether they should be trusted in their future work. And that also casts a shadow over the trainees in the lab or other collaborating scientists from labs across the hall or, in different states and different cities and different countries. It hurts the reputation of everybody whose name was on that paper when it gets retracted. It's a waste of time and money and resources because some scientists or researchers might change the direction they were heading because I published something that was completely fabricated. And now they think, I don't need to finish these studies because, Kost lab showed this. So I'm going to go ahead and try to see if I can replicate those data and build a foundation upon those findings to do more research in that area. Well, if I completely fabricated that data, then that's just wasting their time, money, and resources when they could have been doing something better. The institution is also hurt, the reputation of the institution, because it reflects badly if some of the investigators or one of the investigators is found to have committed research misconduct and ultimately defrauded the government out of money. And there can be some expense, like hundreds of thousands of dollars to adjudicate research misconduct, and then a burden on the institution because it involves faculty having to be on committees to investigate these allegations of misconduct. The institution may have to repay grant money, hundreds of thousands of dollars or more. I'll give you an example of where it's much more than that. Something you might not think about is society can feel betrayed because now they've lost trust in scientific findings. They don't believe the research anymore. And that hurts the credibility of everybody. And that can lead to a loss of taxpayer money or people who donate to organizations. And I hate to point out any single organizations. And I'm not saying that anything from this organization was ever fraudulent or involved research misconduct. But let's say that people donate to, the American Heart Association because heart disease is such a common problem. But if it comes out that the American Heart Association dollars went to fund some research that was found to have misconduct and the data was fabricated, then maybe people won't want to donate their money to funding research through that organization anymore. The other thing is people might contact their congressmen and congresswomen and say, hey, we want to withdraw some of the money from the National Institutes of Health or National Science Foundation. We don't want to use our taxpayer dollars to fund this fraudulent or data anymore. So it can hurt all research. So what can we do to think about trying to prevent or detect research misconduct? Well, the first thing is researchers have to hold themselves accountable. They have to hold themselves to the highest ethical standards in research. Do not lie, do not cheat, do not steal. That's just like do not fabricate, which is like lying, do not falsify, which is like cheating, and do not steal, which is like plagiarism, right? And if somebody is a type of person who lies and cheats and steals all the time through, from middle school through high school and cheats on tests in college, they're probably not the right kind of person to be going into research. So maybe it's a little bit selective. You just have to select out yourself if you're not somebody who's ethical. There are also online programs and required courses for training young researchers, educating them about scientific misconduct. And that's what I'm doing here with this module, Responsible Conduct in Biomedical Research. But I also teach a 2-credit course every spring and fall for our graduate students here at USD Sanford School of Medicine. And they're required to take that in order to get their PhD. There's city training, collaborative institutional training initiatives online that young researchers can use to educate themselves about how to avoid falling into the traps of scientific misconduct. Mentors should be helping with this. The principal investigators and lab technicians, everybody should be watching everybody else to make sure that there's nothing shady going on, but mentors in particular, right? And weekly or monthly lab meetings where people are presenting data. It's like, well, if you're standing next to somebody at the lab bench and seeing that things aren't going well, and yet in a lab meeting they're presenting data that looks, unbelievably perfect, then maybe you need to have a talk with them about, is everything okay? And mentors need to be kind of overseeing the ship. They need to be making sure that things are going in the right direction and avoiding putting pressure on the people that work under them to the best of their ability. Some pressure is okay, but too much pressure may force people to do things that they shouldn't. When you prepare your manuscript for publication, you send it to a publisher, and an editorial board or some ad hoc reviewers take a look at it, and it's possible that in the peer review process, when your work is being reviewed by other people who work in that field, it's possible that they might detect some, plagiarism or something about the figures that doesn't look right, maybe some data manipulation, but it's not a really strict or a great way of detecting fraud or misconduct through peer review. Study sections at granting agencies. So you submit a grant, there are experts who are looking through your grant, and they might recognize some plagiarism or some manipulation of figures, lanes on a gel, something like that might not look right to them. There's software that's been developed to detect plagiarism, like Turnitin.com, or software to detect image manipulation. And some of that is through artificial intelligence. But the sad thing is, artificial intelligence can also be used to create falsified papers, fabricated and falsified data, and to manipulate figures. And then we have that Ryan Commission we were talking about before in 1995 defined the processes for oversight, investigation, and adjudication that we talked about earlier. And hopefully that's a deterrent, knowing that you could be in a lot of trouble for committing research misconduct. The Whistleblower Protection Act is also part of that commission report in 1995, the recommendations that went forward. And as part of that, there was a reward. And so, for example, and I'm not trying to pick on Duke University here, but this is a case, it's getting kind of old now. It's from 2019 when it was reported that a university employee there, a researcher, this article says, fudged data to help the university win and keep lucrative grants from the National Institutes of Health and the EPA, Environmental Protection Agency. So I believe this was involving pulmonary research. And Duke University had to pay back to the US government $112.5 million to settle that, which those accusations. And as part of that, what really uncovered this was a whistleblower by the name of Joseph Thomas. And as part of that Ryan Commission in 1995, they recommended that the whistleblower get 30% of any refunded money on these federal research grants, And so in this case, Mr. Joseph Thomas here received $33 million in a settlement due to this whistleblower act. So there is that as well to prevent people from committing research misconduct, is knowing that it's possible that other people are really watching you closely to make sure that you're not committing that. The Public Health Service and the original opinion I mentioned earlier said that research misconduct does not include honest errors or differences of opinion. That is not considered research misconduct. In terms of how we start to look at research misconduct, the federal agencies like the Public Health Service, PHS, they put the initial responsibility for identification, investigation, and adjudication of misconduct allegations within the institution. If it's a university, it'd be within the university. But the PHS does have the right to review that process as well as the findings that the institution comes to, because obviously an institution may want to try to protect its own reputation and the researchers within it. And so the PHS can step over that and say, hey, we're going to conduct our own investigation. Any institution that accepts funding from the public health services, like the National Institutes of Health, has to have in place a way of dealing with misconduct, and they have to acknowledge that their Office of Research Integrity, that is the Office of Research Integrity from the United States Public Health Service, may step in to investigate allegations of misconduct. So that's another thing that's keeping the universities honest as well, or the institutions. When an allegation is reported of misconduct within an institution, that triggers an inquiry-based process. It's kind of like having a grand jury take a first look at it to see, it's kind of a fact-finding mission to look at whether a full investigation should be launched. So this might be made up of a few faculty members. And if they think that there's enough, that inquiry panel thinks that there's enough information, they may recommend a full investigation. A second committee called the investigative panel would be set up, again, possibly made up of faculty members, to carry out that phase. And then if the investigative panel concludes that, yeah, it sure looks like misconduct has been committed here, the accused is still given the right to an appeal. So the time frame is long. This can take several months to get to the point where the investigative panel has what they need. And then because of the rights of the appeal of the accused researcher, it may take years to actually come up with the finding of research misconduct. But that puts a huge burden, as you can imagine, on the institution itself and all the faculty that are involved in doing the work of the inquiry panel and the investigative panel. So in conclusion, for this Sanford School of Medicine Research Basics video series on responsible conduct of biomedical research, we've gone through, we defined misconduct and all that. And I want to conclude by saying that there are some kind of notable quotes here. Bertrand Russell said, "We trace the evils of the world to moral defects and lack of intelligence, but we know little about eliminating moral defects and the unethical behavior that come from those moral defects. However, we can improve intelligence through education. And that's really the purpose of this module, is to let you be aware of what it is to commit research misconduct so that you can avoid that, right? And be aware of your colleagues around you as well. And the Nobel laureate Salvador Luria said that there must be a peculiar pathology in the personality of someone who would cheat in research. And the reason this was stated is he said it would require a really distorted sense of reality. Like some would have to be delusional to think that one could cheat in research in science, because this is an area that demands internal and external controls and reproduction and verification of those results in other labs. Your internal controls, right? You're in that experiment that you're doing, you have controls built in. You have like a placebo group, for example, or a group that doesn't receive the treatment. And then there are other people around you who should be watching as well. And then once you publish that data, it has to be replicated, reproduced by others, and verified by other labs. And if that doesn't happen, then your paper just kind of falls off to the side, because if you fabricated that data and nobody can reproduce it, then nobody really believes it anymore. And that's considered really the self-correcting nature of science. The self-correcting nature of science that, again, if some paper takes us in a certain direction, but we can't replicate that data, then we just kind of say, well, it's probably not really valid. There are some cool references that you can use. I use this book called Macarena. It has some text and some cases in it that can be used. The Federal Register is a good resource, and you can literally Google Federal Register and research misconduct and come up with some cases. And that's run through the Office of the Federal Register as part of the National Archives and Records Administration, NARA. So I hope this was helpful. Thank you for your attention.